Right now, without moving from where you are sitting, I want you to do one thing. Open your mouth, stick out your tongue, and look at it in a mirror or your phone camera. Really look at it. The color, the texture, the coating, whether it has cracks running down the center or swollen edges pressing against your teeth. What you are looking at is not just a muscle you use to taste food. According to over 2,000 years of documented clinical observation and a growing body of modern research that Western medicine is only beginning to take seriously, your tongue is a real-time diagnostic map of what is happening inside your body right now. Your liver, your kidneys, your heart, your digestive system, all of them are leaving visible signatures on the surface of your tongue. And most people have been walking around with urgent warning signs in their own mouths without knowing it. Doctors are not telling you to check your tongue every morning, and the reason for that is more uncomfortable than you might expect. Because if tongue diagnosis becomes mainstream, a lot of very expensive diagnostic visits become unnecessary. But the science is there. And today, I'm going to walk you through exactly what your tongue is telling you, organ by organ, symptom by symptom, so that by the end of this video, you will never look at your tongue the same way again. Before we get into specific colors and textures, you need to understand why the tongue works as a diagnostic tool at all. Your tongue is one of the most vascularly dense structures in your body. It receives blood supply from branches of the external carotid artery and drains into the internal jugular vein. That means the blood circulating through your liver, your kidneys, your lungs, your digestive tract, all of it is also circulating through your tongue. Changes in blood chemistry, inflammatory markers, hydration status, hormonal shifts, bacterial overgrowth in the gut. All of these alter the microscopic environment of the tongue's surface, changing the behavior of the filiform and fungiform papillae, the tiny projections that give your tongue its texture, and influencing the microbial ecosystem that produces the coating you see each morning. This is not mysticism. A 2022 study published in the journal Frontiers in Cellular and Infection Microbiology used metagenomic sequencing to show that the microbial composition of tongue coating is statistically different in patients with type 2 diabetes, heart failure, and chronic kidney disease compared to healthy controls. The tongue is literally expressing your internal biochemistry on its surface. The question is whether you know how to read it. Let us start with color, because color is the fastest signal and the one most people can check in under 10 seconds. A healthy tongue is a consistent medium pink, not bright red, not pale, not purple tinged, medium pink with a thin white coating that disappears after you brush in the morning. That thin white coating is normal. It is the baseline. Everything else is a deviation, and deviations have meaning. If your tongue is pale, noticeably lighter than medium pink, almost white or washed out, your body may be signaling one of two things. The first is iron deficiency anemia. When your red blood cell count drops, less hemoglobin is circulating, and the tongue's vascular tissue, which is visible through the mucosa, loses its pink color. A 2019 study in the Journal of Oral Pathology and Medicine found that tongue pallor had a statistically significant correlation with hemoglobin levels, particularly in women under 50. The second possibility is what traditional Chinese medicine has documented for centuries as a pattern of qi and blood deficiency, now being mapped to thyroid dysfunction, chronic fatigue syndrome, and autoimmune conditions that suppress vascular circulation. If your tongue is pale and you are also experiencing fatigue, cold hands and feet, and brain fog, those three symptoms together are telling you something specific about your blood and your thyroid that is worth investigating. If your tongue is bright red, not the warm, medium pink of health, but a vivid, almost inflamed crimson, particularly at the tip or the sides, pay attention. The tip of the tongue in traditional diagnostics maps to the heart and the lungs. A consistently red tongue tip can signal chronic stress-driven cardiovascular strain, elevated cortisol, and sympathetic nervous system overactivation. Modern cardiology has begun documenting this connection. A 2020 paper in the European Journal of Internal Medicine noted that patients with hypertensive heart disease showed significantly higher rates of red tongue coloration compared to normal tensive controls. If your tongue tip is red and you have been under prolonged stress, that is not a coincidence. Your cardiovascular system is leaving a visible mark. A red tongue with a yellow coating is one of the most specific combinations in tongue diagnosis, and it maps almost directly to the liver and gallbladder. The yellow coating indicates a disruption in bile metabolism. When bile is not moving efficiently, bacterial overgrowth in the gut increases, and the metabolic byproducts of that overgrowth migrate upward and alter the microbial ecosystem on your tongue. Yellow tongue coating combined with fatigue after eating, a bitter taste in the morning, and mild pain or heaviness under the right rib cage is a pattern that should prompt a liver function panel. Not because tongue diagnosis is definitive, but because when these four signals appear together, the research suggests they are rarely coincidental. A purple or bluish tongue is the one I want you to take seriously. Purple or blue coloration indicates poor microcirculation. Blood is not moving efficiently through the small capillaries of the tongue, which means it is likely not moving efficiently through other vascular beds either. This pattern is associated with cardiovascular insufficiency, chronic hypoxia, and in some cases, early-stage kidney dysfunction. If you are looking at your tongue right now and seeing any purple or blue tint, especially in the veins underneath the tongue, which you can see by lifting it, that is a signal worth discussing with a doctor. Not tomorrow, this week. Now let us talk about texture, because texture is where the most nuanced information lives. A healthy tongue surface has a slight roughness. Those are your papillae, functioning normally. What you are looking for are deviations from that baseline. Cracks, swelling, scalloping, a completely smooth surface. Each of these patterns has a documented physiological correlate. Cracks running down the center of the tongue, a single deep fissure along the midline, are associated in both traditional systems and modern gastrointestinal research with chronic digestive insufficiency. The midline of the tongue maps to the stomach and the small intestine. A deep central crack, particularly one that has been present for years rather than appearing suddenly, suggests chronic low stomach acid, poor enzymatic digestion, or long-term gut inflammation. A 2021 study in the World Journal of Gastroenterology found fissured tongue was significantly more prevalent in patients with irritable bowel syndrome and small intestinal bacterial overgrowth compared to healthy controls. If you have a fissured tongue and you also experience bloating, irregular digestion, or food sensitivities, your tongue is confirming what your gut has been trying to tell you. Scalloping, those wavy indentations along the sides of the tongue that look like the edge of a pie crust, is caused by the tongue pressing against the teeth due to swelling. That swelling reflects fluid retention and lymphatic stagnation. In clinical practice, this pattern is frequently seen in patients with thyroid dysfunction, particularly hypothyroidism, where metabolic slowdown causes tissues to retain fluid. It is also associated with spleen and pancreatic weakness in traditional diagnostics, which maps to poor carbohydrate metabolism and blood sugar instability. If your tongue has scalloped edges and you are frequently fatigued after meals, struggle with stable energy throughout the day, and carry weight preferentially around the abdomen, these signals are telling the same story. A completely smooth tongue, what medicine calls geographic tongue or atrophic glossitis, where the papillae are flattened and the surface looks almost polished, indicates nutrient deficiency, specifically B vitamins. Vitamin B12, folate, and iron are all required for the healthy proliferation of tongue papillae. When those nutrients are depleted, the papillae atrophy. A 2018 review in the Journal of the American Academy of Dermatology confirmed that smooth, atrophic tongue is a reliable clinical marker for B12 deficiency, often appearing before neurological symptoms develop. If your tongue looks unusually smooth, that is a signal that your body may be running low on a nutrient whose deficiency, if left unaddressed, eventually damages your nervous system. The coating on your tongue deserves its own moment because it is the signal most people overlook entirely, and it is one of the most dynamic, changing with your digestive state, your hydration, your sleep, and your gut microbiome composition. A thin white coating that clears after brushing is normal. What is not normal is a coating that is thick, that does not clear with brushing, or that is a color other than thin white. A thick white coating indicates gut dysbiosis, an imbalance in the microbial population of your digestive tract. The same bacterial species that overgrow in a compromised gut environment, particularly Candida and certain gram-positive bacteria, also colonize the tongue surface and produce visible white film. If your tongue has had a thick white coating for months, your gut microbiome is out of balance. This is not speculation. The 2022 Frontier study I mentioned earlier showed that thick tongue coating was a reliable indicator of altered gut microbiota composition in multiple disease states. A thick yellow coating points to the liver and gallbladder pattern I described earlier, but with more intensity. The thicker the coating and the deeper the yellow, the more pronounced the disruption in bile flow and gut bacterial balance. Combine a thick yellow coating with a red tongue body, and you have one of the most commonly documented patterns of liver stress in both Eastern clinical tradition and emerging integrative medicine. A black or very dark brown coating is rare and alarming. It can indicate severe bacterial overgrowth, prolonged antibiotic use that has decimated normal oral flora, or in some cases, early-stage serious systemic illness. If your tongue has a black coating, that is not something to observe and monitor. That is something to bring to a doctor immediately. Here is the part of this that I want you to sit with. Everything I have described today, the pale tongue of anemia, the red tip of cardiovascular stress, the scalloped edges of thyroid dysfunction, the fissured center of gut inflammation, the thick white coating of dysbiosis. Every single one of these signs is visible to you right now for free in 30 seconds, without a blood draw or an imaging scan or a copay. Your body has been communicating with you. Every morning when you brush your teeth, the answer to several important questions about your internal health is sitting right there on your tongue, and nobody taught you to read it. I am not telling you that tongue diagnosis replaces medicine. What I am telling you is that when these visual patterns align with symptoms you are already experiencing, they are not random. They are signals, and learning to read them is one of the lowest cost, highest information habits you can build into your morning routine. And learning to read them is one of the lowest cost, highest information habits you can build into your morning routine. Check your tongue tomorrow morning before you brush. Write down what you see. Color, coating thickness, coating color, any cracks or fissures, scalloping on the edges. Then check it again the next morning, and the morning after that. Give it 2 weeks. You will begin to see patterns. You will begin to notice that your coating gets thicker after certain foods, that your tongue color shifts when you are stressed, that the fissures deepen during periods of digestive difficulty. You are not diagnosing yourself. You are paying attention to data that your body has been generating every single day of your life. That data belongs to you, and now you know how to read it. If this video changed the way you think about your own biology, subscribe to the channel. Everything we do here is about giving you the tools to understand what is happening inside your own body, in language that is accurate, evidence-based, and actually useful. Drop in the comments what you saw when you checked your tongue today. I read every single one, and I will see you in the next video. Drop in the comments what you saw when you checked your tongue today. I read every single one, and I will see you in the next video.